Hello everyone, I'm Dr. Lee. Have you ever wondered what's going on inside that room in the hospital marked ICU on the door? This medical science popularization video takes you to understand the ICU, a place that guards the last line of defense for life. ICU is the abbreviation of Intensive Care Unit in English, and its full name is Intensive Care Unit. The patients admitted here are all the most critically ill and unstable in condition. What kind of patients will be admitted to the ICU? Patients who have just undergone major surgeries, such as coronary artery bypass grafting, liver transplantation, major neurosurgical operations, those who have been rescued from sudden cardiac and respiratory arrest, those with severe pneumonia, those with acute respiratory failure whose oxygen supply in general wards can no longer be sustained, those with severe trauma and massive hemorrhage, myocardial infarction, stroke, severe septic shock, and those who need close observation after major surgeries, as well as other conditions. Each bedside is equipped with a complete set of life support devices, and doctors are on duty 24 hours a day. This is the significance of the ICU. What exactly are the differences between an ICU and a regular ward? First, there is the issue of personnel allocation. In a regular ward, one nurse has to take care of over a dozen patients, while in an ICU, one nurse can handle at most 2 patients, and for critical patients, it can even be one-on-one. Secondly, there are the devices. The monitor at the bedside displays heart rate, blood pressure, blood oxygen, respiration, body temperature, etc. in real time. If any of these indicators are abnormal, an alarm will be triggered immediately. There are also ventilators, defibrillators, infusion pumps, tracheal intubation instruments, etc. always kept at the bedside. These devices that are not commonly seen in ordinary wards are standard here. We introduce some common medical devices in intensive care units and their functions. List of 22 core equipment and functions in the intensive care unit, ICU, vital sign monitoring and detection equipment 1. Multi-parameter bedside monitor, real-time continuous monitoring of electrocardiogram, ECG, heart rate, non-invasive blood pressure, pulse oxygen saturation, respiratory rate and body temperature, support arterial blood pressure, IBP, central venous pressure, CVP, and hemodynamic monitoring. 2. Bedside blood gas analyzer, POCT. It can rapidly detect arterial blood gas, POW2, POCO2, pH, electrolytes, Na+, K+, Ca2+, lactic acid and hemoglobin within minutes, and assess respiratory function and acid-base balance. Respiratory and airway support equipment 3. Invasive mechanical ventilation ventilator. For patients with tracheal intubation or tracheotomy, it provides positive airway pressure ventilation support, such as PSV, CMV, PCV/VCV modes, to maintain lung ventilation and gas exchange. 4. Non-invasive positive pressure ventilator, NIV, provides BiPAP or CPAP ventilation support to conscious patients without tracheal intubation through a mask or nasal mask. 5. High-flow humidified oxygen therapy device, HFNC. It provides heated and humidified ultra-high flow, up to 60 to 80 liters per minute, mixed oxygen to improve oxygenation in patients with mild to moderate respiratory failure. 6. Electric negative pressure aspirator/wall-mounted aspirator. It is used to clean the secretions and sputum in the tracheal intubation, oral and nasal cavities, and respiratory tract of patients. Circulatory, rescue, and advanced life support equipment 7. Defibrillation/pacing monitor, used for asynchronous electrical defibrillation, to terminate ventricular fibrillation/pulseless ventricular tachycardia, synchronous electrical cardioversion, to correct rapid arrhythmias, and percutaneous temporary cardiac pacing. 8. Microinjection pump, high precision, microliter/milliliter level, continuous pumping of critical drugs such as norepinephrine, vasoactive drugs, and sedatives and analgesics. 9. Infusion pump, precisely control the input speed and total volume of large volume crystalloid solution, colloid solution, and parenteral nutrition solution. 10. Extracorporeal membrane oxygenation device, ECMO. It provides extracorporeal gas exchange and circulatory assistance support, VAECMO/VVECMO, for patients with extremely severe cardiopulmonary failure. 11. Intra-aortic balloon counterpulsation device, IABP, for patients with cardiogenic shock or severe left heart failure. It increases coronary perfusion through diastolic inflation and reduces the left ventricular afterload through systolic pumping. 12. Hemodynamic monitors, such as Pico/FlowTrack/EV1000, they precisely monitor stroke volume, SV, cardiac output, CO, peripheral vascular resistance, SVRI, and intrathoracic blood volume, ITBV, through thermal dilution or pulse profile analysis. Renal replacement and organ function support devices 13. Continuous renal replacement therapy, CRRT, machine, for patients with acute kidney injury, severe water and electrolyte/acid-base disorders or sepsis. It continuously and slowly removes toxins and performs ultrafiltration dehydration for 24 hours. 14. Temperature control system, ice blanket, ice cap/heating blanket. It is used for mild hypothermia treatment, such as brain protection after cardiopulmonary resuscitation, or for precise temperature control of patients with intractable high fever. Bedside imaging and auxiliary diagnostic equipment 15. Bedside critical care ultrasound, POCUS, rapidly perform cardiopulmonary ultrasound evaluation, inferior vena cava variation assessment, pneumothorax screening, and deep venous catheterization/puncture guidance. 16. Mobile bedside X-ray machine, bedside DR. Without moving the patient, it can complete the plain film shooting of the chest and abdomen at the bedside to confirm the position of the tracheal intubation and deep venous catheter. 17. Fiber optic bronchoscopy. It is used for deep airway sputum aspiration, alveolar lavage, BAL, guidance of difficult tracheal intubation and examination of airway bleeding. 18. Platelet function/coagulation elastography, TEG, bedside rapid assessment of the patient's overall coagulation status, coagulation factors, platelet aggregation and fibrinolytic activity, guiding precise component blood transfusion in cases of severe massive hemorrhage. Basic protection and ward facilities 19. Electric multifunctional bed for preventing pressure sores. It is equipped with automatic weighing, an alternating inflatable mattress for preventing pressure sores, multi-angle body position tilt and prone position ventilation assistance functions. 20. Intermittent pneumatic compression pump, IPC. It circulates and compresses the lower extremities to prevent deep vein thrombosis, DVT, in patients who have been bedridden for a long time. Others 21. Enteral feeding pump, specifically designed for the precise infusion of enteral nutrition, EN, in critically ill patients. The pump speed is controlled by a microcomputer to achieve constant temperature, constant speed and quantitative injection of nutrient solution, or nasogastric drug, into the patient's digestive tract through the nasogastric tube/nasojejunal tube/fistula tube, effectively preventing gastric retention, aspiration, diarrhea, and reflux. 22. Video laryngoscope, combining a high-definition camera with a liquid crystal display. It reveals the structure of the patient's glottis and airway. In the emergency tracheal intubation of critically ill patients, the management of difficult airways and the establishment of bedside airways, it significantly improves the success rate of one-time intubation and reduces the risk of laryngeal trauma and aspiration. Once a patient encounters an emergency, doctors and nurses can reach the bedside within seconds and complete life-saving operations such as tracheal intubation, cardiopulmonary resuscitation, and defibrillation within minutes. The third aspect is monitoring density. In the ICU, every test and every dosage of medication is precise to the minute or even the second. There is another issue that is often overlooked. The ICU is a multidisciplinary collaborative team. Besides critical care doctors and nurses, there are also respiratory therapists, anesthesiologists, clinical pharmacists, rehabilitation therapists, nutritionists, etc. The professional judgment of each individual jointly determines the daily treatment plan. What is the most concerning issue for the family members? First, can I accompany you? Regrettably, the vast majority of ICUs do not allow family members to accompany patients, mainly because a sterile and quiet environment is required. Frequent entry and exit can easily increase the risk of infection and may also interfere with other patients. Second, how to know the condition. There are fixed visiting hours every day, usually about half an hour. The doctor will explain the patient's condition in person. During the day, family members can call the designated number to get in touch. Third, how much is the cost? ICU expenses range from several thousand to tens of thousands of yuan per day. Medical insurance can cover most of them, but the self-paid portion remains a burden for working-class families. Fourth, do I need to be sent to the ICU? This decision is usually evaluated by a medical team, mainly focusing on whether the patient needs life support, close monitoring, and the understanding and cooperation of the family. ICU is not a place to wait for death. In fact, most of the patients who are admitted can be transferred back to the general ward after several hours to several weeks of meticulous treatment, and their conditions stabilize, and eventually recover and go home. Only a few patients with severe conditions or poor responses to treatment will eventually reach the end of their lives. So, if there are family members around you in the ICU, please do believe that the doctors and nurses there are doing their utmost to save your family member's life. Just as seen at the end of the video, a bright ray of sunlight streamed through the window and filled the entire ward. Even the cold machines were brimming with warmth, and everywhere was filled with the hope of life. Thank you for watching this video. Your collection, subscription, sharing, and comments are all the driving force for my updates. See you next time.